Okay, I want to talk about pain today, and especially what pain actually is, because we don't really know that as well as we think we do. We have an idea of what pain is. We all know how it is to experience pain. Some of us experience pain all the time, and often those are the types of people I work with. So I learned a lot about the neurology behind pain, and particularly in the last 10 years, a lot there has changed, which is interesting to me and probably a lot of our colleagues. I went to medical school in the 1990s, and a lot of what I learned there about the nervous system has really been completely turned on its head. So in order to keep it simple, I brought my spine model to just give you an idea of what actually happens before we have the sensation of pain. Now you know that the sensory nerves are coming from the periphery of the body, in this example, somewhere on the leg, all the way down there. The nerves are getting into the spinal cord. Then the signal is being transmitted to another nerve that goes all the way up to the head. Now, in the brain, there is the next center of processing. But let's get back to the very beginning of the sensation. What we learned in school is that you have nociceptors, and the job of the nociceptor at the very end of this nerve is that this nociceptor is transmitting a pain signal. So that was the idea we had, right? This is already wrong. And that's where it starts, and that's where we really have to shift our thinking. The nociceptor doesn't say there is pain in that leg. The nociceptor says there is potential danger, in particularly this spot on the leg. And then the signal for potential danger gets into the spinal cord. Now you might be thinking, this is irrelevant, whether it's called potential danger or whether you call it pain right away. If at the end of this whole cascade it turns out to be pain, then you can just as well say the nociceptor is a pain receptor. But it's not that easy. It's not as if you just push a button and then a bell rings. The way that it really works is that already in the spinal cord, there is a decision being made. And that decision hangs on a few different factors already. Like inside the spine here, you remember probably from your neurology classes that the nerves have a sheath around them that is insulation but also has other factors. And already there are neurotransmitters that are really influencing whether the signal gets transported further into the brain or whether it just stays at the level of the spinal cord. It also plays a big role whether a signal comes from one nociceptor or from 5,000. You can imagine if that leg was completely mangled and there is a splinter fracture and all these different splinters are hitting a lot of different nociceptors, well, then you probably have not only a few thousand, but a million nociceptors saying potential danger in that leg. Now, with that many signals ending up in the spinal cord, of course, all the gateways are open, the signal goes up into the brain. But what if you just have a few? What if, for example, you have a shallow cut with a very sharp piece of glass? You probably don't even feel that because there's so little tissue destroyed and there's hardly any pressure on the tissue that only hits a very few of those nociceptors. So what happens in the spinal cord if those signals end up there is nothing. I mean, it sounds just like there is a tiny whisper in the background that is being discredited immediately. So you see how it already matters on the intensity, on how many nociceptors are saying, hey, potential danger in the leg. The other influences that I was hinting at with neurotransmitters in that area, with the hormonal situation in that area, the whole idea of whether there is a higher level of inflammation present, all these things also play a role, but this gets way more complicated. And this is also the area where we're not really up to date with the research. Right now, these things are being evaluated very carefully, and we can expect in the next 10 years a lot more information about what actually happens in the spinal cord. So for you, important to remember right now is the signal being transmitted is just potential danger. The spinal cord already makes a decision, and then the final decision of whether there is pain or not is actually being made in the brain.